Hey guys, I just wanted to do a little video regarding some stuff about my appointment yesterday. I actually had a talk with my mother yesterday, and she seemed to have been doing pretty well with being okay with this transition, but pretty much our talk last night was to the least bit. I have to say it was a bit disappointing. She tried to encourage me not to do this. She was very uncomfortable with it. Pretty much, she's not okay with it, and tried to convince me to do other ways of becoming a man. I don't understand, because the paper said that there's other options besides taking testosterone therapy. But that was just a big talk that I had with my mother yesterday after my appointment. I wanted to go over some stuff. They gave me pretty much like a waiver to sign that I agree, that I understand what all the side effects may possibly be, whether it's uncommon or very common. It has to be put on the paper for protocol reasons, and I have to sign it. So I can't go there saying, well, I didn't know this was going to happen. It's on the paper. But I just wanted to go over some of this for people who are planning to transition. I did get this paperwork. It's 3 sheets of information. I read all of it twice. Pretty much the expected effects of testosterone therapy. The masculine changes in your body may take several months to become noticeable, and usually take 3 to 5 years to be completed. If you choose to go on testosterone and you decide to stop, or even if you are on it and there's side effects that you get, these are permanent. Whether you stop or not, these are things that are gonna stay, which is basic stuff most everybody knows. The pitch of your voice becomes deeper. Increased growth, thickness, and darkening of body hair. Facial hair growth. Possible hair loss at the temples and the crown of the head, which could lead to male pattern baldness or possible complete baldness. And of course, everybody's favorite, increase in the size of the clitoris / phallus. These side effects that are listed next are not permanent. Whether you continue the treatment or not, these side effects can be reversed, but if you continue, they may possibly still be there. They may go away. But menstrual periods will stop usually within the first few months of starting testosterone. And I'm sorry if anything I say may be a trigger warning to any of you. I'm just reading the information that they had given me as fair warning before I started my therapy. So there may be some terms on here that you may not feel comfortable relating with or whatever, but I apologize. I'm just reading what's on the paper. Possible weight gain. If you gain weight, this fat may tend to go towards the abdomen and midsection rather than the butt, the hips, and the thighs, and all of that womanly stuff. It will end up making your body look more masculine. Increased muscle mass and upper body strength. Possible feeling of more physical energy. Skin changes including acne may be severe, which I know I already suffer mild acne in the T-zone area. So I know for a fact I'm going to end up with acne. Not a deal breaker. Let's see. Increased sex drive. Changes in mood or thinking may occur. You may find that you have a decreased emotional reaction to things and possible increased feeling of anger and aggression. Some persons find that their mental health improves after hormone therapy. The effects of hormones on the brain are not fully understood. The risks and possible side effects of testosterone therapy. Possible loss of fertility. You may not be able to get pregnant after being on testosterone therapy for some time. How long to take to be permanent effect is unknown. Some persons choose to harvest and bank their eggs before starting testosterone therapy. Testosterone is not a reliable birth control. However, if your periods stop, you could get pregnant. If you are having penetrative sex with a natal male partner, you should discuss using a form of birth control with your medical provider. If you do get pregnant while on testosterone, the high levels of testosterone in the system may cause harm and even death to the developing fetus. Other effects of testosterone on the ovaries and on developing eggs are not fully known. Some trans men, after being on testosterone for a number of months, may develop pelvic pain. Often this will go away after some time, but it may persist. The cause is not known. The lining of the cervix and the walls of the vagina may become dry and more fragile. This may cause irritation and discomfort. It also may make you more susceptible to sexually transmitted infections and HIV if you have unprotected penetrative sex. The effects on the risk of breast, uterine, and ovarian cancer is not known. Possible changes in cholesterol, high blood pressure, and other changes to the body that might lead to an increased risk of cardiovascular disease, such as heart attacks, strokes, and blockages in the arteries. Possible changes in the body that might increase the risk of developing diabetes, increased appetite, and increased weight gain from both muscle and fat. Increased risk of sleep apnea, which means breathing problems while you're sleeping. Pretty much you stop breathing in your sleep for a couple minutes. Sometimes it can be dangerous because people don't start breathing. Some people continue breathing. It's a dangerous thing to suffer from. You can cause possible damage in your head if you went without oxygen for too long while you sleep. Possible abnormalities in blood tests for the liver. Possible worsening of damage to the liver from other causes, as if you're taking medication, everything is going through your liver and your kidneys. It can make it more susceptible to damage from these medications or whatever you may be doing. If you're drinking, it could increase the risk of damage to the liver. An increase in hemoglobin, and I don't know what this is. It's big names for blood. It's pretty much talking about the number of red blood cells. It'll increase the amount of red blood cells. If this increases the levels higher than normal in males, it may cause problems with circulation, such as blood clots, strokes, and heart attacks. Increased sweating, weakening of tendons, and increased risk of injury. Possible worsening or triggering of headaches and migraines. Possible increase in frustration, irritability, or anger. Possible increased aggression and worsening impulse control, which I fully understand that that's a possibility. I'm still willing to take the risk. I do have a lot of like impulse control. I have OCD, I have ADHD, so I know it is going to heighten or worsen the effects of those disorders. Which brings to the next part, possible worsening of bipolar disorder, schizophrenia, and psychotic disorders or other unstable moods. I suffer from a lot of those. I have depression, anxiety disorder, phobic anxiety, I have ADHD, OCD. I'm screwed, but it's a chance I'm willing to take to be happy. Pretty much it just, you have to sign initial, I have any questions about the risk of testosterone treatment, a medical provider of a member of the medical team answered my question about the risk of testosterone. I would like to discuss ways to help quit smoking. They give you all these different options that you can also like fill out and stuff like that. I don't know. Pretty much then at the bottom it shows you understand and then puts a list of all the possible other risks. Smoking cigarettes may increase some of the risk of taking testosterone therapy. I haven't had a cigarette for over a year. I've been vaping, so I did tell my doctor this, and she didn't see anything wrong with it. So I think I'm in the safe. Taking testosterone in doses that are higher than recommended. This is important. Taking testosterone in doses that are higher than recommended will increase the risk of testosterone, will increase the risk of testosterone treatment. Higher doses will not necessarily work better to masculinize the body. In fact, abnormally high amounts of testosterone can be converted to estrogen that may interfere with masculinization. So always stick to your dose. Always do it the way your doctor told you to, which best fits your anatomy and your body. Testosterone treatment is expected to be lifelong. Suddenly stopping testosterone after a long time on the medication may have negative health effects. You may choose to stop hormone therapy at any time for any reason. You are encouraged to discuss this decision with your medical provider. Your provider may decrease the dose of testosterone or stop prescribing testosterone because of the medical reasons and or safety concerns. You can expect that the medical provider will discuss the reasons for all treatment decisions with you. Hormone therapy is not the only way that a person may appear more masculine and live as a male. Your medical provider and or mental health provider can help you think about these other options, which is what my mother was getting at about maybe you don't need to be so drastic about the testosterone, because she's petrified, I think, or whatever. She doesn't like it. She made a comment about you need to remember other people. It's going to be hard for them to not misgender you. And remember, you've been my daughter for 26 years. It's going to be a hard thing to like remember or to accept or whatever the case is. But pretty much the last paper is all the signing, and it's making sure that you completely understand everything. You agree to everything that's listed on this paper. It says you agree to take testosterone only at the dosage in the form that your medical provider prescribes. Inform your medical provider if you are taking or start taking any other prescription drugs, dietary supplements, herbal or homeopathic drugs, or street/recreational drugs or alcohol, so that you can discuss possible interactions with and effects on your hormone treatments. I haven't drank in a little over 3 years, so I'm safe. I don't do drugs. I don't do all of that. I am on medications. I already got the documents of that, so no red flags so far. Inform your medical provider of any new physical symptoms or any medical conditions that may develop before or while you are on taking testosterone, and discuss the evaluation of these conditions. Inform your provider if you think you are having a bad side effect from the testosterone. Keep regular follow-up appointments. This may include appointments for pap smears, pelvic exams, and mammograms. Having regular monitoring blood testing done. Your provider will discuss with you what tests are necessary in order to monitor for potential harmful effects and to ensure that your testosterone treatment is safe and effective. Pretty much that's it. And then at the bottom is like whether you decide to sign your name in blood or not. At the bottom it has two options that you can check off. I choose to begin testosterone therapy, and I do not want to begin testosterone therapy. And then ask for signature, preferred name. What I loved about this place was when I first signed in for my appointment, right away they were very respectful of how you feel about your gender and appearance. I saw a lot of trans people, gay people. It even seems some of the workers may have been part of the gay community themselves, which is very comforting to know that you're working with other people who also are going through somewhat of the same thing. Maybe not testosterone treatments, but they're very familiar with the community. When I first signed in for the appointment, they asked for my date of birth, my name, all of that, and then right after, when everything was all set, asked me what name would you like to be referred as, and I put Cris, C-R-I-S, is perfectly fine, and then even asked me, sorry, my ferret's like going crazy right now in the cage. She's like, I don't know, being weird. But they asked me what name I would be more comfortable being referred as. They also asked me what I would like my pronouns to be, and I just said typical he, she, he, him, his is perfectly fine. And it was like almost a breath of fresh air to walk into the appointment and wait for them to call me in, and I hear Cris being called out when usually I'm prepared for them to, you know, say my birth name, and the nurse and everybody in the waiting room are looking around waiting for this big feminine lady to walk in because I have a very feminine birth name. Dead name to some people. The term makes me a little uncomfortable. I have issues with the whole death thing. I would just call it my birth name, my original name. I don't know. I haven't really come across needing to use these terms at all yet. But pretty much it was really cool to be able to go there, and it was tailored to my comfort, and I liked that. And the people that worked there were very nice. Surprisingly, my follow-up appointment is 2 weeks, and if she says come back in another 2 weeks after my next appointment is all blood work, and she has to listen to my heart, but my doctor is faxing over my results for my blood test and this and that. Hold on.